Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining me again this week.
Absolutely. Thanks for having me.
Absolutely. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. Now, if you haven't joined us in the past, so many months that we've been doing this, the way it works is we collect questions over the past week for the doctor and we present them to her today. She's never seen them before. This is all off the cuff. And if you haven't had a chance to submit your questions via our social media or our website, you can still do so in the live chat in this broadcast. And we'll try to get to as many questions as we can in this short half-hour period that we have with the doctor. So we're going to start with vaccine questions today, or vaccine adjacent questions, because that's top of mind for everybody. And then we'll move on to some other questions. So doctor, are you ready to go?
Yeah, let's go.
Excellent. Let's get started. We're going to start with Eugene's question. Eugene says, I have recently, about a month ago, recovered from a very bad case of COVID. I'm doing okay now. I did the antibodies test and it was through the roof, much higher than my friends who had both vaccine shots. According to my doctor, there is no point in getting any of the vaccines for me for at least 4 to 6 months. Now, officially, I've had one shot before I got sick. Will recent recovery be included in the COVID passport, the same as it is being done in Europe? And should I take the second shot?
Okay, so really good questions. I'm really glad to hear that you have recovered. As far as I know, with the passport, there is no way to identify if you've previously had COVID. That certainly is something that is looked at if you've been identified as a close contact of someone. If you've had COVID within the last 90 days and been cleared by public health, you won't have to isolate, for example. But even though your antibody levels may be high, it's more than just antibody levels that indicate immunity. And again, for that longer term immunity, that second dose will give you that better protection, especially against the Delta variant. It would be safe for you to get the vaccine, your second dose, as well.
Okay, and let's move on to another one. Curious asks, what is the threshold of deaths from the vaccine before it gets recalled?
Okay, so the vaccine is actually under very close scrutiny. I think I've shared many times in Ontario and in Canada, there is reporting of people who have had adverse events, side effects that could be related to the vaccine occurred following vaccination. We know for sure the AstraZeneca vaccine had that rare side effect of the severe blood clots. We know that people in Canada have died from that vaccine. With regards to the Pfizer and the Moderna vaccine, however, they do not have that side effect. And as far as I know, there have been no deaths associated with those two vaccines. But it is something that continues to be followed and is one of the reasons why we are giving Moderna and Pfizer vaccine in Canada over and above the other vaccines that have a rare but serious side effect associated with them.
Right. And as soon as we saw the serious side effects, we stopped giving the AstraZeneca vaccine. It was pulled pretty quickly, I would say.
Yeah, and the AstraZeneca is still a very good vaccine, but when we didn't have a lot of supply of any vaccines and we were in the midst of our third wave, that was definitely a very good choice. Right. But now we actually have a good supply of Pfizer and Moderna. We know that those vaccines don't have that rare side effect, so they have a better safety profile. We know that actually they perform better in some circumstances as well too. So there's good reason to get to the Pfizer and Moderna vaccine. But globally, the AstraZeneca vaccine is still a very good vaccine, especially in places where there may be no other vaccine. And the risks of COVID far outweigh any rare side effects to that vaccine.
Right, right. Okay, let's take some live questions that are coming in right now. From YouTube, why are all deaths and hospitalizations counted as COVID when it is the underlying causes, which is why people are getting hospitalized? In that case, the COVID positive test becomes irrelevant.
So people who may have asthma, obstructive pulmonary disease, maybe a heart disease, If they get COVID and they die because they had the COVID infection, that underlying health condition may have contributed to their death. But if they didn't have COVID, they might not have died. And so that's why if you die with COVID, even if you have an underlying health condition, it is counted as a COVID-related death.
Right, right. More live questions coming from the website. Bresna asks, since the vaccine does not prevent people from getting COVID-19 and doesn't prevent them from spreading it to others, why are vaccinated and unvaccinated people treated differently? Or I suppose at this point, because today the vaccine passport certificate comes into play, they will or won't be allowed to do certain things.
Okay, so the vaccine certainly does prevent infection. It also does prevent spread. But the goal of vaccination is actually to prevent severe infection and hospitalizations. Mm-hmm. And the vaccines do a superb job of preventing severe infections and hospitalizations. They do prevent infections, but they are not, their efficacy is a bit lower for preventing infections. But we do know that if you are unvaccinated, you are 7 times more likely to get COVID. If you get COVID, you are 40 times more likely to end up in the ICU. So the risks of being unvaccinated and getting COVID and spreading COVID continue to be much, much higher as well.
Mm-hmm. Absolutely. Another question coming in from our website here, Samantha asks, I have had pins and needles since my first dose of the vaccine 4 months ago. I'm not qualified for an exemption according to Ontario, and Pfizer tells me this is a severe reaction and I shouldn't get a second dose of the shot. What am I supposed to do?
So I think what you need to do is to follow up with your primary care provider. Maybe you need a referral to a specialist. Pins and needles is very vague. It's hard for me to understand what that means. Maybe you need, is there an underlying health condition, for example? Is it related to the vaccine? Could you get the vaccine being closely observed, for example? So I think that when you're in that type of position, I would follow up with your doctor, and if needed, get a specialist referral.
Right. Okay, let's jump back into the cache of questions that we have. Paul asks, is the vaccine safe for people with Crohn's disease?
Absolutely, yes. The vaccine is safe if you have Crohn's disease and would be recommended, because if you have Crohn's disease, that's a medical condition. Sometimes with Crohn's disease, you're on drugs that can weaken your immune system. And so if you were to get COVID, it could be very, very severe.
Right, okay. And then Rob asks, I am going back on methotrexate. Will I be eligible for a booster dose? And how long after my second dose should I be getting my booster dose?
Okay, so those criteria are constantly being updated. There's a point where time since vaccination, what medications you're on. So I would follow up with your doctor. There is a referral process to be able to get a referral to qualify for that third dose, and your doctor should be able to provide that for you. But absolutely, if you are on a medication that weakens your immune system severely, then you would qualify for a third dose. So talk to your doctor about getting that referral if you qualify.
Right. And usually, doctor, those medications are people who are possibly transplant patients, possibly, and the other people that qualify, you said, were those who are on chemotherapy, I think, in terms of third doses?
Actually, the list has been expanded, actually. So the National Advisory Committee on Immunization put out updated recommendations that had a broader list. And so Ontario has gone ahead to recommend that as well, too. So it includes more than just chemotherapy. There are a lot of other medications that are included in that. I don't know what dose you're on, when you're starting, so in terms of your specific eligibility, you should follow up with your doctor. But yes, absolutely, more groups with weakened immune systems have been added to the list.
Okay, wonderful. And let's move on to Parveen's question. Parveen asks, every day we're seeing the data that shows that fully vaccinated people are getting hospitalized and being put in the ICU. So who are these people who are getting hospitalized? What caused them, I guess, to get COVID, even though they're fully vaccinated, because this is causing a lot of insecurity among us.
Okay, well, let's actually turn the question around and note that when you go to the provincial website, so ontario.ca, it actually shows you per day the number of people that are in ICU who are unvaccinated, are partially vaccinated, which means they had one dose, or are fully vaccinated. And the number that are unvaccinated far outweigh those who are fully vaccinated. So I think that's a really important point to know. There are also more people who are fully vaccinated in our province. Many people have been vaccinated. So the actual proportion of the people who are vaccinated who get COVID is still quite small. What we know is, I can tell you people who are getting COVID who are fully vaccinated, most of them are getting very mild symptoms. For those who end up with a more severe infection, like in the ICU, they often are either older, because we know age for this virus has been a risk factor. You've been at higher risk if you've been older, and also that effect of having health conditions. And often when you're older, you have a health condition as well. So that's really what we're seeing in terms of those people who are getting very sick and are fully vaccinated.
Right. Okay. So there's other sort of conditions, comorbidities, I guess, right, that would contribute to that.
Yeah, and actually there's some recent data that has been put together for Ontario that has shown that even in the elderly, again, that vaccine effectiveness for severe infection in Ontario, even with the Delta variant, continues to be above 90%. It's not 100%, and so, but it is still very, very good, and that should be very reassuring to all of us. It does mean, though, that's why we still have to not just rely on the vaccines, right? That's why, especially if you're older, you have a health condition, wear that mask, don't go to that indoor crowded setting, you know, take those other precautions as well.
Right, right. Okay, this is an interesting one. There's no name on this one, it's anonymous, but it says, we came here from Pakistan, we are vaccinated. I am vaccinated with the Sputnik vaccine and my husband has Sinopharm. Is this recognized in Canada, and how can I get that proof of vaccination for Ontario since the certificate goes into place today?
Yes, so actually there is a process. So if you were vaccinated with a non-Health Canada approved vaccine, if you got 3 doses, then you will be considered up to date. If you got 2 or less doses, you will qualify for a messenger RNA vaccine, so Pfizer or Moderna here. Okay. The way to get it recognized and to determine what you're eligible for, go to your public health unit, and they should have a process to be able to put it in place. At Toronto Public Health, we have a link. It's called a check market survey. So there's a link on our website, how to document your non-Ontario vaccinations, and you complete the information. And they will input that in and get in touch with you to let you know that your receipt is now updated, so you could download it or and the like.
Right. And then, Doctor, you mentioned that if you're vaccinated with 2 vaccines that are not recognized by Health Canada, you can be eligible for a shot of an mRNA vaccine. How does one go about getting that? Do you just book through the regular portal, you know, in terms of the provincial portal, I guess, right, for Toronto?
Yeah, I think the best way for you to start is to first get your vaccines that you didn't get in Ontario documented. So right. First go through that process to get them documented. Then once it's in the system, when you get that additional dose, it will be included and you'll have your full vaccine receipt.
Okay.
But you can also call the provincial booking line. The province still has a vaccine hotline. Toronto Public Health has our Toronto Public Health hotline, and you can also call Public Health to get more information on your specific situation.
Right, exactly, and then they can get vaccinated with that information. Perfect. Okay, let's go to a live question that's coming in here from YouTube. Sirius X asks, do you think the vaccine passports are going to be permanent? This is a concern given that, again, today we're going live with that.
No, I don't actually. I don't think that we're going to be in a COVID pandemic forever. We've talked about this, but right now we're still calling it a pandemic because if we didn't have any of our public health measures in place, COVID would overwhelm our healthcare system. We would be in a very, very difficult place, which some other provinces are facing right now. But eventually, we expect that COVID will become more like influenza, more like, RSV, some of our other seasonal viruses that we know we can expect as we head into the fall and the winter. Cases will increase, but they won't overwhelm our healthcare system. And so that's really, and so at that point, again, a lot of these pandemic measures will be lifted.
Right. Yes. And we've seen over the past few days in the news cycle as well, it's been said repeatedly that the passport is a temporary measure as long as we're in this pandemic state. So that's the answer to that, I guess. Okay. Yeah. Let's move on to, let's see. We've got some live questions. Candice asks, if incidents of myocarditis and pericarditis happen more often with Moderna than Pfizer, particularly for males, and with the second shot, why are males not being advised to get only Pfizer?
So currently right now, the 12 to 17-year-olds are getting Pfizer in Ontario. That is the vaccine that's being given for males and for females. And what I understand is that this is being looked at provincially. If there are recommendations that certain age groups, should only get a particular vaccine, then those recommendations would come from the Ministry of Health, from the Chief Medical Officer of Health.
Right. And currently the numbers in terms of myocarditis and things are not sort of high enough to make that recommendation yet?
They may be, it's being looked at as right. far as I understand, yes. And so what we know is that Moderna has a higher vaccine antigen content compared to Pfizer. Is that what may be part of this? What we do know for sure, though, is whether you think about Moderna or Pfizer, the side effect of myocarditis and pericarditis is still rare, and it is still a mild myocarditis or pericarditis that people are getting, despite which vaccine they are getting. And the vaccines, both of them, continue to be recommended, especially in this fourth wave, to prevent the severe consequences of COVID.
Right. Okay, one more live question here. Doug asks, is there a public site to see the less common side effects or side effects that are still being evaluated from the vaccines?
Well, yes. So Public Health Ontario has a weekly report that they put out on, we call them adverse events following immunization. Public Health Agency of Canada does as well. And there are a number of not common, they're called diseases of special interest, that are being followed globally, actually, to ensure that that those symptoms or those conditions are not being reported at a higher rate. Right.
And then Candace has a follow-up question, actually. She says, Pfizer trials for the 5 to 11-year-olds were only done with a small group of kids. Is it true that the risk factors may only present themselves after we give it to a much wider population?
Well, trials are small compared to giving vaccines to millions of people. And we've seen that with the vaccines so far. Like, the vaccines have been given to over 1 billion, maybe even 2 billion people. And when you give it to that many people, you can find rare side effects. And so that's why when the trials are done, they're sized for a specific number to be able to detect the more common side effects. And that's why we have that surveillance system in place to be able to detect if there are more rare side effects associated with the vaccine. We also have to balance, though, the potential rare side effects or even known rare side effects of a vaccine to the real risks of the illness as well, too. Yes. And the ability for people to spread it, to make other people very sick as well.
Right. And that's been from day one. We've been talking about sort of the balance of risks and benefits. And as you mentioned several times before, Doctor, it is also up to each and every person to assess that for themselves.
That's right. And I know that this question for 5 to 11-year-olds Well, how sick do children get? I think this is something that's under very close scrutiny. I mean, we're seeing in the US, some children have gotten very, very sick. We also don't really know what about long COVID in children, and if they were to get a mild illness, but then have long-term symptoms that last for a long time. So there's a lot that is still being very, very closely monitored.
Right. Let's jump back into our cache of questions here. Geraldine asks, why wasn't everybody's antibodies checked before they were vaccinated?
So often for vaccine programs, we don't actually recommend testing antibodies. It means everyone has to have a blood drawn, then the blood has to go, and the antibody levels don't always correlate to how much protection you have long term. Mm-hmm. So, for measles, for chickenpox, for a lot of other illnesses, we just go based on the history or vaccination record, actually. We know that even if your antibody levels are high, you had COVID, we consider you protected for 90 days. And after that, we don't know how long your protection is going to last, which is really why vaccine is still recommended, even if you had COVID.
Right, and actually that brings me right into our next question from Ron and Tiffany. Both of them have questions about natural immunity. Basically, they're asking, why isn't natural immunity from a past infection being recognized as a status like you're vaccinated because you've already acquired the antibodies?
Yeah, I think maybe the question is related specifically to the vaccine certification process, and that certainly is a provincial policy recommendation. Again, there are ways in which if you've had a previous recent infection, so in the past 90 days, that is certainly taken into account even right now. So if you had a recent infection in the last 90 days, were cleared by public health, and you were a close contact of someone who had COVID, you do not need to self-isolate, just like a vaccinated person.
Right. So that in some cases, that is considered protection enough, but just for those 90 days.
That's right. Yeah. Right. Okay. And as long as you have no symptoms.
Right. Yes, of course. And then Ron asks, from the first day, we have seen that overweight people or being diabetic or having insufficient vitamin D are major factors that lead to mortality. Why do we hear so much about vaccines and so little about fixing obviously dangerous comorbidities?
Okay, I'm not sure whether low vitamin D has been associated, but certainly having a chronic health condition has been associated with getting a more severe COVID-19 infection. But we do know of otherwise healthy people, adults, children too, who have gotten COVID, and young adults, otherwise healthy, who got very, very sick, ended up in ICU. Right. That can occur. We should not assume that all of the people in ICU have a chronic health condition, because that is not true.
Right. Okay. And let's go on. This person's handle is Guyanese Hot Gal. Guyanese Hot Gal asks, is there any specific research about the effect the vaccine has on hormonal changes or women with PCOS? I have heard of women complaining about irregular cycles after having the vaccine.
Okay, so I think PCOS is one of those polycystic ovarian, anyways, it's one of those gynecological conditions that can give you irregular periods. And so getting the vaccine, people might say, I got the vaccine and then I had irregular periods, but maybe they had this diagnosis and actually have irregular periods. So I think that's what we're finding right now with a lot of these claims, is they're not, don't seem to be caused by the vaccine, not linked to the vaccine, but can occur quite commonly within our society. It is something, though, that is under, again, close investigation worldwide to ensure that there have been no links to menstrual irregularities, to fertility. There's no claims for any of those conditions being caused by the virus.
Right. And Doctor, earlier when we had spoken about this a couple of months ago, I believe there were studies being conducted in the UK that were connecting these two things. Has there been any resolution in that sense? Has there been any more results from those studies?
Yep. So the UK has actually added it to their list of symptoms following vaccination. And so their data is posted there. There certainly is has been no declaration of any link to these conditions. There have been studies that have been done looking at, for example, sperm counts, like thinking about fertility, and have been no links there as well too. The other thing is, if you look at it from a global perspective, we're giving this vaccine around the world. Billion, maybe, I don't even know what the right number is right now, but over 1 billion for sure have been vaccinated, and certainly have not seen an effect worldwide on fertility, like that type of thing as well too.
Right. Okay. And then this is coming in from Twitter in our cache of questions here. Brian asks, what vaccination level is needed for TPH to tell the Ford government that it's okay for churches to resume normal capacity limits? Currently, the vaccination rates are at 80 to 85. Does it need to get to 100% before we can resume normal church services?
Okay, so I think, talk about normal, any kind of service or activity. I think we have to recognize that there are still 11 to 12% of our population that don't have a vaccine. Those are our children 11 years of age and younger. And this is one of the reasons why we need very, very high vaccination rates. We certainly have the goal in Toronto for above 90% rates. The highest rates we can get will help to protect everyone, but they still will never eliminate that risk, because we still have a substantial portion who can't get vaccinated just because of their age. And so while we're in this fourth wave, we know the Delta variant spreads more easily. We know that it's here and that it is spreading, continuing to spread. We have to right now, in the current situation, get our vaccine rates up and continue with those precautions. But I just want to assure you, like we've seen with this cycle, with the different waves, as we get out of a wave, restrictions do change. And so I think that's what you can expect.
Right, absolutely. Okay, that's the end of our vaccine questions, and we have a few more minutes, so let's move into the non-vaccine related questions. Wings asks, what are the treatment plans for fully vaccinated symptomatic patients at home and at hospital? Is it treated like a flu at home?
Okay, so whether you're fully vaccinated or unvaccinated, the treatment is actually the same if you have COVID. So if you're at home and you have a milder illness, you can keep track of your breathing, how you're feeling. If you have a fever, to treat the fever. If you have aches and pains, to treat the aches and pains. Make sure you get plenty of fluids and rest. And if you're ever concerned, to seek medical attention right away. And likewise, when you're in hospital, whether you're vaccinated or unvaccinated, the treatments are still the same.
Right, okay. And then let's go to John from Waterloo asks, do we need to get the flu shot this year?
Yes, we will. The flu is going to circulate. I think we can expect influenza, RSV, like all of those viruses that we actually did a very good job of preventing last year, because of the measures that were in place, will likely come back again this fall, because we are still doing a lot more than we were doing last fall.
Right.
And so getting that flu vaccine will be important. Again, for our own protection, to not spread it to others, and also thinking about our healthcare capacity. I mean, even before we had COVID, I work in an emergency department. You can tell when flu season starts because the volumes pick up quite a lot every year. That was even before COVID. And so that's even an added strain in the midst of the COVID pandemic to prevent, again, those hospitalizations.
Right, absolutely. Okay, Dan asks, at what point, since I'm double vaccinated, will the government say that I don't need to wear a mask anymore? What is going to change from now till then? If I'm double vaccinated, why do I need to wear a mask?
So right now, we're still recommending the mask, especially when you're indoors, if you're outdoors and can't keep a physical distance, because of the fourth wave and because the Delta variant is spreading. But once we, get through this fourth wave, we will get through this fourth wave. I mean, we have gone through the previous waves. The recommendations will adjust according to the situation and the circumstance.
Right. And then Melody asks, I haven't heard this before. Melody asks, why is there no zinc given out at the time of either a confirmed case or after the first shot of the vaccine? I don't understand the total blackout on things that would help get people healthy.
Okay, Melody, good question. I'm not aware of a trial showing that zinc is effective to treat COVID-19. There are certainly a lot of things that we can do, that people do to help them recover from viral illnesses. But I have not heard specifically about zinc. I have heard of zinc lozenges. Those have certainly been proven. If you have a very bad sore throat, even from COVID, the zinc lozenges certainly are something that is medically recommended.
Right, okay. Tiffany asks, why do we have higher case numbers this year than we did last year, even though we have the vaccine?
Right, good question. So actually what we're looking for is the hospitalizations and ICU admissions. It's the severe numbers that we're really keeping our close eye on. I can tell you that a lot of the cases that we are seeing, especially among vaccinated, are very, very mild illnesses. Among those who are unvaccinated, it's a different story. And so if you had just a runny nose or a close contact of someone got tested, it would be counted the same as someone who got very sick and got COVID. And so that's why we're really paying a lot of attention on our vaccination rates, because we want those very high, and our hospitalization and ICU numbers.
Right, but in terms of actual case counts, whether they're milder or not, everybody seems to think that they are much higher than they were last year. Is that the case, doctor?
So if you look compared to wave 2, where we were in wave 2 last year, we're tracking about slightly earlier than last year, but about the same. But actually in the past few days, we've had a bit of a plateauing, like the case numbers have been about stable. It doesn't mean we're out of the woods yet though, right? There is still COVID and it is still circulating. And so I think what I would take from the case numbers is it means that we need to still be cautious, but we can certainly get through this fourth wave.
Right, and I think that another thing that you said, doctor, what I'm taking from it is that there might be similar or even higher numbers, but they're not as severe. And so once again, the healthcare system doesn't get overwhelmed.
Exactly, and that's really what we're trying to prevent here. We recognize that people need to be able to, businesses need to stay open. I mean, that's one of the reasons for the certification process as well too. And so it's really to prevent the severe hospitalizations, ICU admissions, because we don't want to be in the position where someone who has a heart attack can't get access to the healthcare that they need.
Right, absolutely. And actually, I didn't even realize that brings us to 1 o'clock already. That half hour always goes by so fast. So thank you so much, doctor, for joining us once again this week. Thank you to everybody who contributed their live questions and the questions that we collected over the week. If we didn't get to your questions, we'll have the doctor back next week and we'll try and get to them then. For now, we'll sign off. Thank you so much, doctor.
Bye.
Bye-bye.